Hello, my name is Mohammad Usman Rafi, working as a cardiac perfusionist ECMO specialist in hospital. Welcome to our YouTube channel. In this video, today we will discuss about the basics of IABP. What's the IABP? Today we will discuss about all IABP related functions and indications, contraindication, and the screen of the IABP. What's the parameters are going in the IABP machine, and what's the components of the IABP machine. Today we will discuss about the IABP topic. To get better understanding of the IBP, watch the video till end and kindly subscribe our YouTube channel and please press the bell icon. This is our intra-aortic balloon pump machine. This called basically IABP machine. So what's the purpose of the IABP machine? That's is basically helping in the circulatory support. It's what's the basically purpose of this one when patient is in cardiac arrest or is in cardiac issue or patient heart needs support from the mechanical device, so we can insert the intra-aortic balloon pump machine. So what's basically the function of this one? We insert the one catheter from through femoral artery, intra-aortic balloon catheter that's going toward the descending aorta, and it's basically inflating or deflating. When it's inflating or deflating, it's basically creating the suction pressure or to decrease the afterload and preload from the LV. So that's the main role of the intra-aortic balloon pump. It's basically not giving the it's not basically the taking of the heart function to itself. So and reduce the afterload or preload. So in this machine you are seeing the this one our ECG. This is our heart rate. This is our arterial line wavelength. This is systolic, diastolic, map pressure. This is our augmentation wavelength, and this is our augmentation pressure. Augment maximum we are keeping on every time we are keeping augmentation maximum. This is our two batteries. This is basically our CardioSave hybrid machine model. That's advanced model of the intra-aortic balloon pump. This is our helium cylinder. We are not using oxygen cylinder in the intra-aortic balloon pump. Why? Because uh, this one helium have more solubility power in the blood. So if it dissolve in the blood, it will not creating the reaction. So if oxygen dissolve in the blood, it causes air emboli. So that's why we are using inert gas, inert noble gas, helium. Okay, so this is our inflation deflation. So that's also basically the monitor. So if you are seeing on the the touch pad of this one, we have five triggers of the intra-aortic balloon pump machine: ECG, pressure, pacer V or pacer AV, or pacer A, and internal mode. Normally we are using for the ECG and pressure mode. For if whichever ECG is better, it's going towards the ECG mode. If pressure is good, then it's going towards the pressure mode also. When we will use the pacer V and AV when patient is on pacing mode. When this one TPM is there, temporary pacemaker is there, then we are converting towards the pacer V and AV. If patient is on arrhythmia condition, then we are going towards the pacer V and AV. Internal trigger when we will use when asystole in the patient cardiac arrest and no have any cardiac contractility is there, pulseless electrical activity. So then in that time if we inserted the aortic balloon pump, so we can use the internal trigger for time being. After, if patient is reverted or rose achieved, then we can go up to the ECG or pressure mode also. So the other thing is our ECG sources, our ECG leads, ECG lead 1, 2, 3, AVR, AVF, all leads are here. This one is our pressure direct or indirect. Direct means we are taking pressures from the our fiber optic cable. Indirect we are taking from the monitor side also. So the other thing, IBP frequency 1 is to 1, 1 is to 2, and 1 is to 3. What is the meaning of 1 is to 1? Basically, 1 is to 1 meaning one function is given by the heart, the other function is given by the IBP machine. 1 is to 2 means now heart is the machine is winning from the patient side. So now 1 is doing by the machine, to functioning given by the heart itself. So 1:3 mean now heart is more improving. So three times pumping by the heart, one is pumping by the machine. Augmentation, that's the means how much we need to inflate or deflate, mean how much the volume we need to suck from the LV. So that's we are keeping on always on the maximum. But when we are going towards the winning side, it normally keeping on the gradually coming from the augmentation side also, or minimum we are keeping at 50%. If we are going below than 50%, there's a chances of the clot formation inside the aortic balloon pump catheter. This is our timing inflation deflation time. If for example sometimes patient is on arrhythmia condition, so we need to set the timing of the our balloon catheter inflation or deflation catheter. So, and also you are seeing this one, our arterial line wavelength. Ideally it should be the M wavelength shape. Okay, so if it's not maintaining, then we are creating the inflation or deflation timing itself. We can do by the how much time for this one we need to take the inflate, and how much time for doing for this one to deflate the catheter. So these are the basically the our touch parameters. Semi auto or auto, when we are initiating of the intra-aortic balloon pump, first we will press this one, calibrate pressure, hold for 2 seconds. Then after that, it's going towards the starting of the intra-aortic balloon pump catheter. Okay, so if we want to stand by, we will press this one. If we need to start, we'll use the start button here. It's also giving intra-aortic balloon pump Doppler. So what's the purpose of Doppler? When we are inserting the intra-aortic balloon pump catheter, we need to check the limb pulses also from that Doppler. So this is our basic main role. When we are inserting retrograde through femoral artery, we are using Doppler to check the pulses of the legs. If I will show you down, this is our, we are keeping on extra cables for we are keeping here. Okay, so this is our helium cylinder in the right side. I will show you here. This is our oxygen helium cylinder. One helium cylinder is here, the other one is in built in the internal rescue mode. Okay, so if we want to change this one, we will take it out, close the helium cylinder, and then replace with the new one. So this is our management basically when we are changing the helium cylinder. Basically is our CardioSafe IBP machine, in which we are using the this one, the fiber optic intra-aortic balloon pump catheter. This one is our fiber optic cable. This one our helium line. This one is our ECG line pressure ECG line cable. So we are connecting with the one transducer. You are seeing this one transducer is here. That's one end is connected with the normal saline with the heparinase solution, uh, 1 ml, and then we are keeping pressure here, and then the other line we are connecting with the end of the catheter in the patient IBP side. So we are connecting with the transducer with the pressure line of the this one intra-aortic balloon pump machine. So this is our red one is the pressure line cable, the green one is the ECG cable, and this one is helium line we are connecting here. This one is our fiber optic cable. Fiber optic, what's the basically the benefit of the fiber optic cable? It's giving the more accurate value of the pressure. If sometimes due to cardiac arrest, low pulse activity is there, or low contractility is there, so only fiber optic cable is is sensing the dead pressure and is giving information regarding about the pressure, and it starts the pump. So this is the basically the beauty of the fiber optic cable. In other conventional IBP catheters not have the fiber optic cable. So that's the basically the difference between conventional with the hybrid IBP machines. Thank you so much for watching this video. Please subscribe our YouTube channel, and if you want to watch more video, we will give you detailed information regarding about intra-aortic balloon pump videos. So see you in next video.